But what scares me even more is that children still die every day of diseases that can be cured. Health must be for all of us.
Spending money on health has so many benefits for every person and every society. There is no more meaningful spending. Why can't we coordinate and act as a team for health?
The World Health Organization, WHO, has done so many amazing things for our health. But now, we are more than 8 billion people living on this planet right now. We're living in times of crisis. We've got pandemics, climate change, and, well, conflicts. In order for us all to handle these challenges, all sectors of society are needed. But it is especially politics that must lead the way to health for all.
On a budget of 35 cents per person each year, the WHO provides health services to 430 million people and protects 600 million people from health emergencies. Imagine what we could achieve if we pulled together stronger.
I am at an age where I know that the fight for a better world is never changing, never ending. We are on a continuous journey. It requires the power of young and old, of our and future generations. All for health.
Distinguished guests, please welcome this evening's moderator. Please welcome Isabel Kumar.
Welcome, everybody. May I add another voice? It's mine, actually. A mum who feels the full weight of that journey we were just hearing about. A mum whose child would most likely not survive without constant and reliable access to medical care. Even having the luxury to switch countries, to get better services, better medication. Help for myself when things got really, really tough. A mum who is acutely aware of the global iniquity of health, of how lucky we are and how unlucky so many others are as well. So I'm adding my voice tonight, not only as your moderator and MC, Isabel Kumar, I'm adding my voice to those millions and millions of people who are looking to the WHO. In our increasingly precarious world, our lives could change in a flicker. The WHO is a constant. It's our united global organization determined to achieve health for all. So tonight, member states and other donors are invited to contribute funds to the WHO's strategy that goes from 2025 to 2028 and show high-level political commitment to the WHO and global health. Now, this investment round is supported by our co-hosts, Germany, France, and Norway. Their ministers of health are with us today. Please join me in welcoming them to the stage. Welcome, welcome. So, Ministers of Health Karl Lauterbach from Germany, Geneviève Darrieussecq from France, and Jan Christian Vestre from Norway. It's a pleasure to have you launch this investment process. Now, I know you all have a few words for our audience, so Minister Karl Lauterbach.
Well, good evening, esteemed guests, colleagues, friends, ladies and gentlemen. It's a profound honor to welcome you to the signature event to the World Health Organization's first ever investment round, hosted by Germany, Norway, and France. Together with my esteemed colleagues, Minister of Health of Norway, Christian Vestre, Minister of Health from France, Geneviève Darrieussecq, and of course, all of you who celebrate this collective strength and the crucial role of WHO, we will work together shaping a healthier future for all. In a time of wars, civil wars, epidemics, pandemics, climate change, catastrophes, it is important that WHO can rely on funding, which is a funding in size up to the task, to the ever-increasing task of WHO. And this is why we are here today. It is an investment, as a matter of fact. It is an investment in the future of health, in the future of our health. It's a good investment for the generations to come. So welcome to this important signature event, and thank you for helping us to shape the future.
Thank you. Madame la Ministre.
Thank you, Karl. Mesdames et messieurs, c'est un privilège d'être parmi vous aujourd'hui aux côtés de mes distingués collègues d'Allemagne et de Norvège. Je tiens à excuser le président de la République française, Emmanuel Macron, qui regrette de ne pouvoir être parmi nous ce soir. Il m'a demandé de vous faire part de son attachement au maintien d'une forte dynamique du multilatéralisme en santé mondiale bien sûr, et je veux saluer à ce titre nos récentes avancées. Des défis restent devant nous, comme l'aboutissement de l'accord pandémie, qui doit permettre de mieux préparer et répondre aux urgences sanitaires, ou encore repenser le rôle des grandes institutions en santé mondiale à l'occasion des reconstitutions financières. Au cœur de cette architecture mondiale rénovée, l'OMS doit jouer un rôle unique et central. Productrice de normes, garante de l'équité et de la rigueur scientifique, il lui revient de veiller à la cohérence de l'action mondiale en matière de santé. Saisissons l'occasion d'être ensemble aujourd'hui pour renforcer notre collaboration et notre soutien à l'action de l'OMS. Ensemble, nous pouvons ouvrir la voie à un avenir meilleur et plus sain. J'invite tous les États à s'engager dans ce nouvel élan de soutien à l'OMS, à la hauteur de leurs moyens. La France prendra toute sa part, comme elle l'annoncera le 17 décembre prochain. Merci de participer à cet engagement vital.
Merci.
Merci beaucoup, Geneviève. Distinguished guests, I would also like to extend my heartfelt welcome to all of you present here at this great gathering here today. It is truly inspiring to see such a diverse group of dedicated and passionate people united in our shared vision for a healthier future. In hosting this event alongside our esteemed partners and friends from Germany and France, we have a remarkable opportunity to make a significant impact, not only for the World Health Organization, but most importantly, friends, for all individuals who rely on our commitment. Vielen Dank.
Thank you very much. A big thank you to our hosts. And I think we're going to remind ourselves now of why we are all here. let's watch this video from the WHO.
You're watching this video because you care about health, because health for all is an investment, not a cost. Because we all need health. Societies, economies, families, each and every one of us. Which is why it's so clear that the World Health Organization, WHO, needs your support, so that over the next 4 years, together we can save 40 million additional lives. Thanks to a strong new strategy which all governments have created together, based on the latest science, which all governments will implement in their countries and communities. Guided and coordinated by WHO. We are a uniquely representative organization. Our members are East, West, North, South, hot and cold, big and small. Our partners are diverse, each bringing important expertise to the table. If we have fully funded WHO's new strategy, by 2028, we will all be able to say, together we have created 10,000 climate and shock-resilient health facilities, trained 3.2 million more health workers, and analyzed thousands of signals to identify, assess, and inform on 30 health threats per month, so outbreaks are identified within 7 days. But to implement the strategy, WHO needs to be appropriately and sustainably funded, with predictability and with enough flexibility. That's why in 2024, we're launching the investment round. We are grateful to all our supporters and encourage our funders to follow those who are already committing flexible and predictable funding. Investment in WHO yields healthy results, a prudent investment, and a moral imperative. It moves us closer to the vision of health for all. We need you, each of our member states and partners, to turn this vision into reality. All for health. Health for all.
Now, for the WHO to reach its funding target, collaboration with philanthropic foundations and other civil society partners is vital. So I'm delighted to invite to the stage with me now Mr. Gabriel Leung, who is the director of the Institute of Philanthropy, Amanda McClelland, who is the senior vice president of Prevent Epidemics at Resolve to Save Lives, and Sunny Frost Helt, who is the senior director of policy, program and partnership with the World Diabetes Foundation. Welcome. I'm going to stand to you. So, Mr. Leung, now you've already generously pledged to the WHO at the launch of the investment round, but I understand you have a new announcement.
Indeed. So on behalf of the Institute of Philanthropy established by the Hong Kong Jockey Club Charities Trust, I'm very honored and privileged to pledge $10 million towards this funding round.
That certainly deserves a big hand of applause. Amanda McClelland, now you've worked with the WHO for many years. How's that experience led you to today's announcement?
We've been collaborating with WHO over the last 7 years to really drive action at the country level on the world's biggest killer, hypertension. So we are also proud to pledge $10 million at this event to drive action on trans fat elimination and hypertension.
How fantastic. And Sunny Frost Helt, now diabetes prevention and treatment is a key priority for the WHO and for your foundation. Can you tell us about your commitment to working with the WHO?
Yes, so we have worked with the WHO for the past 20 years to support diabetes prevention and care in low and middle income countries. And today I am honored to announce a contribution of $10 million towards WHO's fight against diabetes in low and middle income settings.
What a terrific start. Thank you so much. Now, you may take your seats and thank you so much. That was just brilliant news. Now, not all our donors are able to be with us tonight. We received this film detailing more country pledges featuring government ministers from Europe.
Is the foundation of economic stability and prosperity. No country can hope to single-handedly tackle the complex health challenges that the world is currently facing, because global health is interconnected, and the World Health Organization has a pivotal role that is clear to all. As a global community, let us act now. Let us strengthen the WHO's capacity and ensure that its health investments are robust and long-term. Malta, therefore, is pledging its support to the WHO investment round with the sum of €400,000 towards a healthier and more secure future. Thank you.
Dear colleagues, hello everyone. I would like to begin by thanking Germany, France and Norway for organizing this important event. Today, more than ever, Spain reaffirms its unwavering support for the investment round and its commitment to WHO as the organization that should be at the center of global health governance. In the last decade, Spain's contribution to WHO has increased by 50%, and we will take advantage of this round to continue making progress. We are working with the Presidency of the Government, the Ministry of Foreign Affairs, the IC, the Cooperation Spanish Agency, to complete the final procedures, and we expect to announce a specific figure this month. Today, I want to confirm that Spain is determined to expand its efforts in this investment round, supporting the implementation of WHO 14th General Programme of Work as a clear bet on multilateralism and for global health. So thank you all very much.
For many of us, the world is a safer and healthier place because of the World Health Organization. However, conflicts and crises threaten the health and well-being of millions of people. The World Health Organization is an important beacon of hope for some of the furthest behind communities. So that the WHO can respond to all our needs, Ireland has taken a number of steps to increase the volume and the predictability of our funding. We have tripled our contribution since the pre-pandemic period, and I am delighted to announce at least €30 million in financing for the period 2025 to 2028. Thank you.
Chancellor Schulz, President Macron, Prime Minister Storer, Director General Tedros, thank you all for organising this meeting. We all understand that multilateralism matters, and that nowhere is this clearer than global health security. Diseases like COVID or Mpox don't simply stay contained in one country or another. So we all have an interest in the strength of one another's healthcare systems and the strength of the WHO. Convinced multilateralists need to make this argument, but we also need to deliver. Funding and reforming the WHO is in all of our interests. It needs to be more agile, more effective, more transparent. The UK is currently the largest flexible contributor to the WHO. I hope others can be ambitious on flexible contributions so that the WHO can respond quickly to changing need. In the run-up to establishing the WHO, my predecessor, Ernie Bevin, commented, "The channel cannot stop germs." The logic is as sound today as it was then. That's why Britain supports the WHO and why we support this initiative today.
Director General, Excellencies, Ministers, dear colleagues, I'm happy to share that Denmark plans to pledge 70 million Danish kroner each year from 2025 to 2028. As one of the top contributors of flexible voluntary funds, Denmark fully supports the ongoing efforts to give WHO the needed muscle to handle new health challenges and improve health systems across the world. With global health threats on the rise, we must unite to ensure a strong WHO. We must unite to ensure a resilient global health system. Let us commit to sustainable funding that allows the WHO to lead the way in expanding universal health coverage for all. Thank you.
Distinguished colleagues, through virtually, it is my pleasure to join you at the WHO Investment Run Signature event at the World Health Summit, and I want to thank the co-hosts France, Germany and Norway for organizing. The right to health is central to ensure all other human rights and also priority of our development cooperation and humanitarian action strategy. It is unfortunate that we had to experience the COVID-19 pandemic and other health emergencies to realize that our daily lives depend on global health. Therefore, WHO needs to rely on predictable and sustainable financing for the successful implementation of its 14th General Programme of Work. I'm pleased to announce Luxembourg's pledge of 47.5 million euro, including a voluntary contribution of 1 million euro from the Ministry of Health and Social Security. This pledge represents the most important financial support from Luxembourg to the WHO to date. For the first time, we'll include core voluntary contributions. The WHO can rely on Luxembourg's political and financial support. Thank you for your attention, and you team, stay strong.
What tremendous messages of support, pledges and partnerships. Well, we're going to hear now from state representatives and hear some more pledges. And I'm delighted to invite to the stage Minister of Health of Mauritania, Abdullahi Sidi Mohamed Wade, the Minister of Health of Greece, Adonis Georgiadis, His Excellency the Ambassador of Finland to Germany, Kai Zawa, and Mr. Roland Dries, representative of the Ministry of Health, Welfare and Sports in the Netherlands. Welcome. As you come and the Minister of Mauritania, will you please tell us about your pledge?
Excuse me, I will speak in French.
I can translate.
OK, thank you. Pour renforcer le travail que fait l'OMS au niveau mondial.
So to reinforce the work that the World Health Organization has done at world level.
Et pour accompagner son nouveau système, le cycle d'investissement.
And to support this new cycle of investment.
Au nom du président mauritanien et du président de l'Union africaine.
In the name of the President of Mauritania.
Je déclare et j'ai le privilège d'annoncer que l'Afrique a déjà contribué à hauteur de 47 millions de dollars.
The African Union, if I'm correct, has already donated up to $47 million.
Exact. Et d'autres États suivront très bientôt.
And more states are going to follow suit.
Yeah.
Thank you very much. Minister of Health.
First of all, I want to thank Germany, France, and Norway for this fantastic event. It's a great honor for me participating here. I come from a country that we recently exited from a huge financial crisis, and our system of health wouldn't stay together without WHO support. So we know very well how much important is all the things WHO represents. I want to acknowledge Mr. Tendros, Dr. Tendros' efforts worldwide to fight not only the pandemic, but with WHO fight one bigger pandemic, the misinformation and the fake news that's spreading around the world and can destroy human minds and human logic. Having said that, and I see Mr. Gates, that he's coming to the room, who is fighting misinformation very, very tough all this recent time, and I want to thank him for that. So Greece as a nation that acknowledges what WHO is representing, is still a very big contributor of WHO and will continue to be for the next years, with more than 20 million euros in helping WHO constructing a health for all and all for health, because health is really important. And I want to acknowledge here the presence of my friend, Mr. Hans Kluge, from WHO Europe, because my country and our system of health wouldn't be the same without you, my friend Hans. Thank you very much.
Thank you. Ambassador.
Yes, thank you very much. I would like to thank our three co-hosts and Mr. Chancellor. Great honor to be here with you, Director General. On Finland's behalf, I would like to announce the addition of 1 million euros contribution, which comes on the top of the previous voluntary contribution. So we are doubling our input, and it will go to WHO space budget as flexible funding. So we hope it serves that purpose well. Thank you.
Thank you very much, Ambassador of Finland. And Mr. Roland Dries, could you tell us about your pledge?
Yes, thank you very much. Let me start by congratulating the German government, our neighbors, with this fantastic event and for this important moment in time, the replenishment of the next global program of work of the World Health Organization. The Netherlands sees international health as a priority, and we should give the WHO as much flexibility to fill in the priorities according to this program of work. Therefore, I'm very happy to commit $20.6 million in unearmarked flexible funding to the WHO, next to the things, of course, we keep on doing, like helping them fighting Mpox or financing our collaborating centers. So, thank you for the good work.
Thank you so much. I think they deserve another big round of applause. Thank you so much for that. So, as you've been hearing, our contributions that we're receiving are growing, and they are working towards a sustainable, flexible, and predictable financing model for the WHO to carry out its mandate. So, let's greet this first session of success with an interlude by the Slicks a cappella ensemble.
Friei varinkum, zirindriei varanki, triai varinkum, ziridrei ararirei, frea papapati, zirindrei, frea papapati, zirindrei, preazi varindrei. Sin Frea papapati, sidindrei, frea papapati, sidindrei. Triasi padindrei, frei varindrei varangi, si padindrei varangi anarindrei, ia fandrei fandrei, fandrei fandrei, si padindrei varangi, sing frera. Free,
That was so beautiful. It's kind of like a balm to the soul. Now, one of the WHO's most important philanthropic donors is the Bill and Melinda Gates Foundation. It's been collaborating closely with the WHO since the early 2000s, saving millions of lives through health, education, and poverty reduction programs. A warm welcome, please, to Bill Gates, co-chair of the Bill and Melinda Gates Foundation.
Chancellor Schultz, Director General Dr. Tedros, Dr. Priest, thank you for hosting us today and for inviting me to share a few words with this esteemed audience. In my life, I've been very fortunate to participate in two societal revolutions. Twice, I've seen almost impossible ideas become reality. The first was 50 years ago when Paul Allen and I founded Microsoft, and we dreamed of a computer on every desk and in every home. At that time, many people thought that was crazy, that it'd be impossible. But today we've gone even beyond that, where everyone carries almost a supercomputer in our pockets. The second societal revolution began about 25 years ago when I was transitioning to my second career in philanthropy. At the turn of the century, I was stunned to find out that nearly 10 million children were dying before they reached their 5th birthday. I was a new father at that time, and when I saw that number, I was horrified. Back then, the idea that we'd be able to cut that death toll in half seemed as impossible and idealistic as the idea of personal computing. But in fact, that's exactly what happened. A single generation later, the number of kids who die before age 5 is now less than 5 million a year. And I consider this I think we should think of this as one of the greatest achievements in human history. And it's no coincidence that this revolution in global health began around the same time as we started several new global partnerships. Gavi, the Vaccine Alliance, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the Global Polio Eradication Initiative have collectively saved over 80 million lives. And of course, the World Health Organization has played a central role in every major global health achievement of the past 75 years. The global eradication of smallpox, still the only human disease we've eradicated. The near eradication of wild polio, where we're down to just now 2 countries that's left. The response to COVID-19. Today, WHO continues to play a crucial role by gathering essential data on disease outbreaks and vaccine coverage, providing technical expertise, coordinating emergent responses, and setting the standards that other health institutions rely on. We need the WHO to make sure that our risk of pandemic is kept very, very low, because we saw what the cost of a pandemic was. The things WHO does, no country can do on its own. Together, WHO and these organizations provide a comprehensive approach to global health. Alongside partners like the World Bank's International Development Association, They are responsible for the unprecedented progress. So global challenges need global solutions. And when we pool our resources, we bring together the expertise across sectors and geographies, we multiply the impact of those resources many times over. The Gates Foundation has supported global health R&D and health institutions as its top priority since its inception. And as we'll be celebrating our 25th anniversary next year, we'll make it clear that our support for these organizations is the best money we've ever spent. And I believe that the citizens of every donor nation should feel the same way. But we should not feel complacent. The fact that childhood deaths are under 5 million a year is an achievement, but it's still 5 million children. And I think we can all agree that that is far too many. It's been a quarter century since I was a new father, wondering if we could cut it in half. Today, I'm a new grandfather, wondering if we can cut it in half again. And the answer is that if we're focused, if we prioritize this, we can. Now, sadly, I don't think this is going to be easy. We do have on our side lots of new innovations, ways of preventing women from getting cervical cancer, the HPV vaccine, ways of preventing women from getting HIV, a shot that you only have to take twice a year, a trial of a TB vaccine. I could go on and on. The innovation pipeline is as strong today for health and malnutrition as it's ever been at any time. The limiting factor, therefore, is not the science, it's the funding. After decades of expanding, funding for global health is now contracting. This year, amongst the top donors, including EU, Germany, France, the US, and others, over $9 billion has been cut from aid budgets. I understand the budget pressures, I understand the reasons that happened, but that really challenges us. And we really need to make the case that ideally over time, as there's flexibility, these budgets go back to the increases that we saw before. And, you know, of course, we need this money to be focused on those most in need. You know, these health challenges are made even worse by climate change. And in fact, the best way to help support climate adaptation is the generosity, the aid generosity in areas like health and in agricultural innovations. We have seen the share of aid going to Africa has gone from 40% to just 25%. And so it's going to require us to drive the innovation faster and to make the case that over time the resources are needed. We see challenges. The pandemic was an interruption. The financial condition of many of these poor countries is tougher than ever. And so this, if we're not careful, we will reach a plateau. You know, we saw an example of that where in Gaza, we saw the first case of polio in over a generation. And so how do we think about this? Well, these great new tools are here, tools that can help mothers survive pregnancy, tools that can make sure kids grow up and their body and their brain develops fully, so not only for themselves but their country. They can get out of the poverty trap. They can do what we've seen many countries in Asia do, which is grow their economy and become self-sufficient. You know, today, India, Vietnam, Indonesia are examples of countries with over 1.8 billion people who are now independent and funding most of their own health system. We do have great vaccines coming along like RSV. We've got the HPV vaccine that will protect a generation of girls from cervical cancer as we receive appropriate funding. So we have to prioritize and we have to get these tools to the people who need them most. We know that investing in global health institutions produces very measurable results. Cynics who say, hey, does aid really have impact? We have very clear answers, very well-known data that these healthy children, they survive, they attend school, and they lift their countries up. Every dollar invested in global health produces over $20 in returns from increased productivity, lower healthcare costs, and economic growth. And that's something we should all celebrate, whether it's the moral cause of helping our fellow humans, whether it's creating stability to avoid unrest, whether it's growing the world economy, whether it's preventing pandemics from breaking out in these countries that are not detected, that we saw was bad for the entire world. There are many, many reasons to stand behind all of these institutions. Our foundation has supported global health for decades, including the WHO. In fact, since 2019, we've granted an average of $260 million to the WHO every year. And we like to make our grants as long as possible, typically 3 years or more. These multi-year commitments are the best way to support the organization because it gives them a clear roadmap to build up the capacity and really do their very best work. I'm really excited that donor nations here are committing to both increase assessed contributions and voluntary contributions. After all, the World Health Assembly sets the WHO priorities, so it really is the member states that are stepping up for that funding. I'm thrilled to see, I would be thrilled to have other nations provide even more, passing the Gates Foundation in the WHO donor rankings, because that would mean more lives saved. So this progress towards the UN goals, the Sustainable Development Goals that include that idea of cutting childhood deaths in half are very exciting. We've slowed, but we can go back to accelerating. Leaders, hopefully they'll speak out, because this is not bleak news, it's very good news. We don't want to turn the clock back in any way. We want to move forward and have these incredible improvements. So I want to thank all the leaders here stepping up to seize this opportunity. Thank you for your commitment to realizing a better, healthier future for people everywhere. Thank you.
Thank you so much to Bill Gates. They're reminding us how far we've gone, but still how far we have to go. Now, Germany is, of course, our wonderful host tonight, but also a long-standing, committed friend and partner of the WHO, supporting its core function of providing global leadership on health, as well as being a top donor to the organization's Fund for Emergencies. As a sign of that steadfast commitment, we're joined by the Chancellor of Germany, Mr. Olaf Scholz.
Director General Tedros, Bill Gates, Minister Lauterbach, Karl, Excellencies, ladies and gentlemen. Whoever saves one life saves the world entire. Most of you are probably familiar with this maxim from the Talmud. Saving as many lives as possible is what the World Health Organization aspires to. One number reflects just how lofty this aspiration is: 40 million lives. That is how many lives the WHO will be able to save over the next 4 years. Because there are more vaccines that protect against serious diseases. Because there is better access to doctors, nurses, clinics. Because medical staff receive more professional training. Because meaningful data is collected. The World Health Summit each year shows how far we have come and what must be tackled next. With the money that we collect at this pledging event today, we can enable many women and men, and above all children, to live healthier lives, with less pain, fewer infections, less suffering. Many thanks to coming to Berlin from around the world to be here. I join in bidding you a warm welcome. One very recent example illustrates how important the World Health Organization is. In August, there was an outbreak of mpox in Central Africa. This disease is particularly dangerous for people who cannot access clean water or reliable medical care, who do not have space to isolate, who have weak immune systems. The World Health Organization sprang into action following the outbreak and declared it a public health emergency of international concern, the highest level of alarm. This shows how swiftly the organization can act. After providing initial emergency assistance, the WHO called on the research community to share data and on countries to donate vaccines. I'm pleased that the German government was immediately able to offer 100,000 doses. Vaccination campaigns are now being organized on the ground and staff are being trained to carry them out. Together with UNICEF and Gavi, the Vaccine Alliance work is being done to ensure that everyone can be safely vaccinated with clean needles, vaccines kept at the right temperature, tents, qualified staff, and campaign. The alarm levels help all countries to better assess emergency situations such as the mpox outbreak and to make decisions accordingly. In May this year, at the last World Health Assembly, we improved the categorization of the alarm levels and made specific adjustments to the international health regulations. This is particularly important for tackling the most serious diseases there are: Ebola, mpox, the Marburg virus, and polio. This enables us to better tailor our response when something happens. We live in a deeply interconnected world. Aeroplanes take off every second, transporting goods and passengers around the globe. Sometimes they also carry viruses on board. The COVID-19 pandemic made it definitely clear that an outbreak of infectious disease anywhere in the world affects us all. Pandemics do not stop at borders. This represents a global challenge, one that we can only properly tackle together. And so we are continuing to campaign for an international pandemic instrument to be concluded sooner rather than later. An instrument that should improve prevention and preparedness, as well as enable us to respond more swiftly to pandemics and cooperate more closely with other states. This is important. The World Health Organization's work benefits us all. What it needs for this work is sustainable financing that gives it the certainty to plan ahead and the flexibility to react. I'm therefore pleased that the member states have decided on a gradual increase of their assessed contributions. This will partially cover the 14th General Programme of Work. We have to find other ways to fund the rest. This includes making good use of synergies with other stakeholders in global health, such as Gavi, CP, and the Global Fund. Recently, just a handful of countries have provided large amounts of funding. It would be better for us to spread the responsibility across many more shoulders. Every contribution counts, no matter how small. Ladies and gentlemen, that is why we have invited you to this pledging event. I'm especially pleased to see that both old acquaintances and new donors are prepared to support the World Health Organization. My thanks go to the Wellcome Trust as well as the Gates Foundation for their unwavering efforts. Bill Gates, your goal and your foundation's top priority are to eradicate polio. Your decades of tenacious work show how difficult this is. But thanks to everything that you and your fellow campaigners have done over the last years, we are better able to fight many other infectious diseases too. I would like to take this opportunity to say to you in person, most sincerely, thank you so much. And I thank all of the states, foundations, and business representatives who have made pledges here in Berlin today. Germany too supports sustainable financing for WHO. And so I'm pleased to be able to share with you today that Germany will be providing the World Health Organization with a total of at least 360 million euro for the next general program of work. Together with our French and Norwegian friends, I appeal to you, join us. Let us support the WHO together. Let us save lives together. Ladies and gentlemen, this pledging event is a great success. We have built trust for a healthier world, and we will continue to do so. And so I say to all of you, from the bottom of my heart, thank you very much.
Germany leading by example and showing the importance of sharing the imperative of global health. And in that spirit, it is my pleasure to invite to the stage the Prime Minister of Montenegro, Mr. Miloko Spajčić, who's going to tell us about his country's support to the WHO in this investment round.
Dear friends, first of all, thank you so much for organizing this event to Germany, France, and Norway. The COVID-19 pandemic showed how important it is for the world to fight health threats together. In this context, the World Health Organization plays a central role. We need a strong WHO to work towards better health for all and to coordinate the efforts of the myriad of players at the national, regional, and the global levels. I am personally committed to make Montenegro a longevity state that implements policies to prioritize the life expectancy and wellness of its citizens in the present, while fostering innovation hubs in longevity research, technology development, etc. For this as well, WHO's work is critical. As a former finance minister, I can say with confidence that for WHO to keep playing its health leadership role for its member states, it must be adequately financed. And for it to operate efficiently, its funding must be both flexible and predictable. It is my pleasure as the Prime Minister of Montenegro to announce that we will be giving USD 80,000 to WHO as a part of its first ever investment round. From a receiver, we are becoming a contributor. And it's not always the population size or the GDP size that matters, but it's also the country's action that matters. I'm also committing to invite other heads of states and governments from the Balkan region to a high-level meeting in Montenegro in coming months to hopefully pledge additional resources collectively to WHO. Thank you so much.
Thank you so much, Prime Minister, and for that invitation. Now, a lot of our high-level guests weren't able to come here this evening in person, but they have got pledges that they wanted to make in this investment round. We've compiled a video with those pledges. Let's take a look.
Excellencies, ladies and gentlemen, dear friends, let me share a quote with you. Health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. End of quote. These words are as true today as when they were adopted to guide the efforts of the World Health Organization at its foundation more than 75 years ago. A very fine organization that I was privileged to serve for some years of my work life. And Norway, my country, was a founding member of WHO and has been and continues to be a staunch supporter of the organization and not least its mandate. I also personally have a strong commitment to this organization, as I said, having had the privilege to serve as the Chief of Staff of former DG, Director General, Dr. Gro Harlem Brundtland, some 25 years ago. As I see it, the World Health Organization is more important than ever. WHO has repeatedly demonstrated its importance as convening and coordinating body, with a mandate and a real convening power. It is the leading normative and technical organization on global public health and plays an important role both in health emergencies and in humanitarian settings. It follows that this also is an ongoing effort, so we have more work to do. The COVID-19 pandemic clearly demonstrated the consequences of not being sufficiently prepared. We felt the impact on our health and our economies, and we still do. This pandemic reminded us of the importance of building and maintaining robust and equitable health systems to prevent diseases from emerging and to handle them properly when they do. It confirmed the need to strengthen international cooperation on global health, and delivering on the pandemic agreement will be a milestone for all of us. So this year we are carrying out the organization's first ever investment round. Our goal is to fully finance the next 4-year strategic period. Having sustainable, predictable and flexible financing will give us a more effective and a more democratic WHO, where the priorities set out by the World Health Assembly will have the organization's prime focus. So friends, let me share with you, the Norwegian government has decided, pending parliamentary approval, to invest 1 billion Norwegian crowns, approximately $94 million in WHO for the period 2025-2028. This amount will be in the form of flexible funding, either voluntary core contributions or thematic flexible funding. So I call upon others to join us by pledging as good as they can to invest in WHO and help make this historic first WHO investment round a success. I thank you all for your attention and good luck.
Dear colleagues, in recent years, the fragility of life has been on everyone's mind. Whether it's a pandemic like COVID-19, armed conflict, or a natural disaster, the true cost is always measured in human lives and suffering, both mentally and physically. Estonia is deeply grateful to the World Health Organization for its support during various crises. We also value its crucial work in addressing key health challenges in the European region, such as alcohol and tobacco use, poor nutrition and mental health. In this light, Estonia is proud to pledge 1.6 million euros to support the European Office for the prevention and control of the non-communicable diseases in Copenhagen. Together, we can protect the health and well-being of our nations and prepare for future challenges. Thank you.
Dear friends, together we have shown the power of solidarity and unity in global health. COVID-19 tested us all, and it was together that we managed to overcome it, thanks to crucial health investments and cooperation across borders. Together, we developed and delivered vaccines to the world in record time. The WHO was and remains our steadfast partner, our collective first line of defense against health crises and inequalities. Now, at the core of our work are the EU Global Health Strategy and Global Gateway. Together, we tackle health inequalities and promote universal health coverage. Strong and resilient health systems should be the norm everywhere. Today, the European Commission stands firmly by the WHO, pledging 250 million euros to strengthen its essential work. From combating Mpox and Marburg to containing cholera, Europe's commitment is clear. We have pledged over 560,000 Mpox vaccine doses for Africa, and we have already delivered more than 200,000 doses. These are the first doses to arrive in the Democratic Republic of Congo to help contain the outbreak. Today, we commit an additional 20 million euros to support the Democratic Republic of Congo in this fight. We're working side by side with the WHO, UNICEF, and our local partners. But we also know that building lasting resilience requires more. It means structural investments and building capacities to better prepare and to respond to health threats. And that's why we're investing over 75 million euros in the WHO's mRNA technology hub in South Africa. All our work brings us one step closer towards delivering universal health coverage across Africa, Latin America, and Asia. And you can always count on Europe as a trusted partner for global public health, for global solidarity and responsibility, and for a future that leaves no one behind. Thank you very much.
Contributions and commitments from the highest level there. Now, the next two organizations, now you've heard them mentioned a few times, and I'm delighted that I'll be able to invite their newly appointed CEOs. These organizations are vital partners to the WHO, so please do join me on the stage, Dr. Sanja Nishta, who's the CEO of Gavi, the Global Vaccine Alliance, and John Arne Rottingen, the CEO of the Wellcome Trust. Thank you so much for being with us this evening. Dr. Nishta, could you tell us about the contribution you'll be making this evening?
Well, thank you very much. The World Health Organization has been a very valued partner of the Gavi Alliance. We work very closely and collaboratively. The World Health Organization is the premier global health agency in the architecture and the landscape of global health institutions. It's the world's health parliament. It is the key norms and standards agency for the world when it comes to health matters. It is the world's regulator for health matters. It is the agency that technically supports hundreds of ministries of health, and it's the world's conscience in health. And for Gavi, which is to your question, we're very proud to be in an alliance with them. They have been critical partners when we say we are vaccinating 1 billion children. They are the ones that we partner with on the ground. They have been key partners with us in COVID-19, more recently during the Mpox crisis, and we will strengthen this partnership going together. We are the largest financial contributors, one of the largest financial contributors to WHO, and it will remain that way.
Fantastic. Thank you so much for that message of support. And Mr. Ottingen.
Yeah, no, I would like first to thank Chancellor Scholz and the ministers for hosting this really important pledging event. Thank you also to Dr. Tedros for your leadership in ensuring more sustainable financing for the World Health Organization through this investment round, the first in its place. Wellcome is a foundation working on how science can improve health for everyone, everywhere. We aim through the research we invest in to shine light on all aspects of health, how our cells, our bodies and our societies work to lead better health tomorrow. As a foundation, we believe it's crucial to have a strong multilateral agency like WHO and global coordination mechanisms who can support countries and facilitate them working together for shared challenges. We, as Wellcome, relies on a strong and science-based WHO with evidence-informed policies, guidance and norms. And this is why we have such a strong and long-standing partnership with WHO already. Its new global program of work is really the world's global health strategy for 2025 to 28. Wellcome today is pleased to pledge renewed and growing support to WHO during this period, with a commitment of $50 million to support the program of work. The first part of our pledge will provide $25 million approximately in support for WHO's work on incorporating impacts of climate change into public health programs and to also document the health benefits of rapid climate action. Given the scale and the urgency of impacts on climate change on health, we urge other philanthropies and member states to invest in WHO's critical work. And our pledge also includes our shared priorities on science in global health, as well as mental health and infectious diseases. We believe it is member states that have the core responsibility for ensuring sustainable financing for WHO. However, as a philanthropy, we also have a role to play in catalyzing action on new and emerging health threats. So we look forward to working with WHO and its partners. Thank you.
Thank you both very much. Now, we are running a tight schedule, so without further ado, please join me in welcoming Mr. Anil Soni, who is the CEO of the WHO Foundation, and Vanina Laurent-Ledru, who is the Director General of Foundation S, the Sanofi Collective. Thank you very much. Thank you for being with us. So, Madame Laurent-Ledru, could you tell us a little bit about your commitment to the WHO?
Thank you so much. Well, today, we've heard it from many ministers and other distinguished leaders. We are facing challenges of unprecedented scale, and we believe that it's never been more important to collaborate across sectors. Sanofi and its foundation, Foundation S, have long been committed to promote, foster health equity, and also we've been doing our part to ensure a planet and an environment that is safe for us all and ensuring well-being and health. So I'm delighted to announce tonight a pledge in the sum of $60 million for the next WHO investment round. Thank you. So this financial contribution will support WHO's vital work in combating infectious diseases, in supporting neglected tropical diseases, and also the development of emergency hubs to protect the most vulnerable. So with this, I would like to thank everybody who's working night and day to preserve health. And I'd like to end by saying that when there is health, there is hope, and hope is everything that we can wish for. Thank you.
Thank you so much. Very beautifully said. Mr. Anil Soni.
I'm proud to announce a pledge of $50 million by the WHO Foundation to the investment round. The WHO Foundation exists to mobilize new resources from the private sector for WHO's life-saving work. We are confirming in today's pledge new funds from new donors, $5 million from Boehringer Ingelheim, including an unrestricted contribution to WHO, and support for suicide prevention in the Americas, 3 million from Novo Nordisk for the prevention and care of non-communicable diseases. And we were very proud to work with Sanofi, the largest existing corporate contributor to WHO, to confirm this latest pledge.
Thank you both very much indeed. I'd just like to recall the words of Ms. Sanya Richter, that the WHO is a parliament of health. I thought that was really beautifully put. And we started this evening looking at the people in that parliament worldwide. And the WHO is the international organization, the parliament, that's designed to safeguard their health. Now, we're here supporting its core work for the next 4 years. And there are thousands of unerringly dedicated people involved in that vital work, not least, of course, Dr. Tedros Ghebreyesus, the Director General of the WHO.
Thank you. Your Excellency, Chancellor Scholz, Dr. Axel Price, Prime Minister of Montenegro, Prime Minister Spajic, dear colleagues and friends, Guten Abend. First of all, I thank Germany, France, Norway, and the World Health Summit for hosting this event tonight. I would like to say, vielen Dank. Merci beaucoup. And tusen tak. And thank you, Chancellor Scholz, for your personal engagement and commitment. Vielen Dank again. You have given us all your time since we have shared with you this idea. And thank you so much for making this event a success. This has been a very exciting and important evening for WHO. And I thank all donors who have contributed so generously tonight. We very much appreciate the confidence and trust you have put in WHO. We live in a time of multiple overlapping challenges: conflict, climate change, displacement, poverty, inequality, and polarization. The ever-present threat of pandemics, the growing burden of non-communicable diseases, the steady march of antimicrobial resistance, and the mounting health impacts of climate change. Meeting these complex and overlapping challenges requires a clear plan and the resources to implement it. At the World Health Assembly in May, WHO member states adopted the plan, the 14th General Program of Work, with an ambitious target to save 40 million lives over the next 4 years. Tonight, we have taken a huge step toward mobilizing the resources we need to implement that plan. For far too long, WHO has operated with unpredictable, inflexible, unsustainable funding that prevents us from delivering the long-term support that countries need. This investment round and other initiatives we have started, like the membership fee increase or the access contribution, and the establishment of the WHO Foundation, will help us to address these challenges. And as you can see, it has already started alleviating the problems. The investment round builds on the foundation of the access contribution that our member states have agreed. It's also designed to put WHO on a more stable financial footing, so we are less reliant on a handful of large donors. We know that we are making this ask at a time of competing priorities and limited resources. That's why I have asked every member state and every partner to step up, and I know that Chancellor Scholz and his team have been making the same request in the lead up to this event. Thank you once again, Chancellor, for your personal commitment. Every contribution counts. When we held our first pledging event at the WHO Regional Committee for Africa a few weeks ago, some of the world's poorest countries announced pledges because they see the difference that WHO makes in their own countries. Once again, my deep thanks to Germany, France, Norway, and the World Health Summit for hosting us tonight, and to all countries and partners who have announced pledges. Thank you for your confidence and trust as we work together to promote, provide, and protect health for all people. Vielen Dank again. I thank you so much.
So every contribution counts, and as Dr. Tedros just said, tonight marks a really relevant step to secure the work of the WHO for all of us and people worldwide for the next 4 years. Now, in a few moments, we're going to invite donors and co-hosts to come to the stage with us tonight for a signature photo, and we thank them. So let's remember that so much has been achieved this evening. More can be achieved still. We're going to celebrate this moment, but before we do, let's listen to some of those voices of the world that we began our evening with and that will help us close our evening tonight.
We have a chance to turn the pages over. We can write what we want to write. Gotta make ends meet before we get much older. We are someone's daughter. We are someone's son. How long can we look at each other down the barrel of the gun? You're the voice trying to understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live with fear. This time, we know we all can stand together. With the power to be powerful, believe that we can make it better. We are someone's daughter. We are someone's son. How long can we look at each other down the barrel of the gun? You're the voice trying to understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear. You're the voice trying to understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live with fear. You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear. You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear. You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear.
So, please come to the stage, everyone who was already on the stage. All dignitaries up to the stage.
You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear. You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear. You're the voice, try and understand it. Make a noise and make it clear. We're not gonna sit in silence. We're not gonna live in fear.
This was a very special evening, Tedros. Am I right?
It was a special evening. Yes.
And this is a special sum which we all achieved together. I'm very proud that we could host it here as a World Health Summit. I'm also proud for everyone in the room, and I think everyone in the room can be proud right now. And with this, we close the story. It can't be getting any better, and there will be drinks and food outside. Enjoy, and thanks to everyone here. And I think it's a brilliant signal for multilateralism which works, and next time we want 100 people here and even much more money for the WHO. Thank you very much. Good evening. Oh, here.